Assalamu alaikum, Your Highness, dear respected panel, dear guests and participants. It's my pleasure to welcome you to the inaugural Lung Cancer Academy Annual Conference, which was organized by the Lung Cancer Academy that was established by a generous support from the Riyadh Foundation under the Saudi Lung Cancer Association, which is a group of the Saudi Thoracic Society. Our mission is basically to lead the educational and training activities for healthcare professionals in thoracic oncology field, including screening, prevention, diagnosis, management, and research, with the vision, hopefully, of becoming a regional and international leader in healthcare professional training and development in the field of thoracic oncology. It gives me privilege to co-direct the academy with the Prof. And be honored to have such an esteemed faculty of the academy. As you see from this list, these are leaders in the field in the region. They represent different disciplines and from different major institutions, both in Riyadh and in Eastern and Western region. Briefly, I will go over the achievements that we have done over the last year, which has significant educational activities as well as research activity. First, we developed the curriculum, and in the curriculum we took into account the category of target audience. We developed modular programs that has lectures. When we look at the target audience, we focus on specialists and non-specialists, so hopefully we have a broad spectrum kind of educational activity. And as you saw in the program, we have a modular kind of structure of our educational programs that composed of lectures selected by experts in the region. And as you will see in the end of the program, hopefully we'll upload all these lectures into a website to be accessible for all people, throughout the year. And by that also we'll be able to update any new findings, any new outcome of research that can be timely updated in the website. All our activities are CME accredited. That's because of the strong infrastructure of the Saudi Thoracic Society. We held 9 monthly tumor boards with more than 250 attendees. 18 of the presentation you will see this today and tomorrow were presented in this tumor board, 2 at each session, and in addition to the case discussion. We participated in the Gulf Thoracic 2014 as the Thoracic Oncology Forum. In addition, we held the current update in pathology of lung tumors in May 2014, focusing on educating the pathologist in the lung cancer tumor. Now we have a research project that we hope to conclude next month, looking at the targets that we can actually treat the patients with available medications. So we're looking at the pattern of druggable targets in the Saudi patients with lung cancer, and we have 5 participating sites, and hopefully next month we'll have the 200 patients of our targets, and we'll have the data published soon after that. So our future direction will be to continue our educational activity, but think of innovation in terms of the depth and the spectrum of the activities that we are going to do. So we'll hopefully develop programs in specialized area in more depth. We will include major cities, in the first year, in the first week of educational activity, so we'll include Jeddah and Dammam, and then after that, hopefully we'll go to a smaller city that has oncology activity, or at least has a need for our activities. And we hope to introduce, enhance, and disseminate 2 major disciplines that are very important, not just for thoracic oncology. If we train the physicians in these disciplines, they will be good for any other specialty, such as the research discipline as well as the evidence-based medicine. So for example, this is the Thoracic Oncology Forum for 2015, will be held in Jeddah. So that will bring major activity to the Western region. And we are working with the King Fahd, the specialist hospital, and the Saudi Cancer Foundation to hold a meeting in Dammam in the next couple of months. As you know, the lung cancer group has been very active in developing and publishing guidelines, and over the last few years we published 3 full supplements in lung cancer guideline that's pertinent to Saudi from Saudi experts, and all these manuscripts have been written by the Saudi lung cancer group. So as for this program, this, actually the culmination of the activity for the whole year, these lectures has been, finalized and will be presented to you over these 2 days. So if you look at the agenda, it shows the modular, focusing in certain area, screening, diagnosis, staging, and so on. And you see that the experts, presenting their cases. There will be also interaction, question, answer session by the end of each module, in addition to case discussion in the appropriate sessions. So these are the 2 days. These are the distinguished faculty that we have, again, from different institutions and different disciplines. And this activity is accredited for 15 CME hours. So now, it's very important to highlight the importance of support, the support that we received from Riyadh Foundation. So when you are doing an educational activity, it is very important to have financial independence from commercial entities. So when organizations like Riyadh come and say, we are sponsoring the Lung Cancer Academy, you develop your education material independent of commercial things, so that will give you credibility to your programs. Your speakers will be independent from any commercial bias, and that's very important for the credibility of such an organization. So we are, thankful. We are very thankful, and we express our gratitude to the Riyadh Foundation for their support of the academy, to establish the academy and launch it, which will be a foundation of many activities to come, in addition to the independent support of the research that we have talked about. So the druggable targets is supported also independently by the Riyadh Foundation alone. So there will be no influence of pharma or anything, on the result. Of course, I would like to thank Alfaisal University with all the leadership, across from Dr. Mubarak and Dr. Qattan, who has been partner and supporter and actually drove the initiative to approach the Riyadh Foundation. And I'd like to thank all the staff, that help us in the in establishing this academy, and I'll mention some of them briefly. But for this particular activity, I would like to thank the sponsor, the platinum sponsor for Lily Oncology, or Lily Oncology. So they sponsor this particular event, not the Lung Cancer Academy programs and establishment and so on, and also Novartis Oncology as a silver sponsor. Now, it's very important to thank also the staff of Alfaisal University, who has been tremendous in helping in this, and especially Dr. Akif Ubaidat. Thank you for taking the lead in managing the conference here. Thanks for all the volunteers and the staff of Alfaisal. Thanks for all the staff of the Lung Cancer Academies, the faculty, all of you, special thanks, the admin support and staff. I would like also to thank the Saudi Thoracic Society for their tremendous support in establishing very strong infrastructure to be able to build on, naming Dr. Hajjaj as the president and Dr. Al-Uraini, who is the executive director of the society, who actually also playing a major role in the organization of the events, getting the CMEs, getting the setup and everything, So I want to thank everybody, and I hope I did not miss anyone. And I would like to thank Your Highness for being with us and supporting us. And thanks for the Foundation, from the top leaders all the way to everybody working there. Thank you very much.